Welcome to the AWIP podcast. I'm your host, Rae Smith. Here we focus on investigations and all things animal welfare related. We're bringing you in depth conversations each week with animal welfare professionals around the globe, so be sure to find us on LinkedIn, YouTube, and Spotify. To learn more about AWIP and our mission, check us out at awip.org.uk or at awipusa.org. We have got a really fantastic episode for you all. I have known and worked with this woman, Esther Meckler, for several months now. She is super fantastic, and we had this good discussion about what are our solutions to the pet overpopulation problem. So we came up with this idea to bring on Dr. Jeff Young to help us talk about the pet overpopulation issue and what is the biggest solution to this problem. So, without any further ado, I want to introduce Esther Meckler and Dr. Jeff Young. How are you doing? Thanks for coming on to the podcast.
Thank you for asking us.
Yeah, thank you very much. Glad to be here.
Yes.
So, Jeff and Esther, would you mind, for those who are watching here, I know that you both have several decades of experience in animal welfare. Can you kind of briefly walk us through your past experience and just how you came to be where you are today?
Go ahead, Esther.
Okay. I've been interested in animals in general for a very long time. And around 1990, I left my traditional workplace to start on something to help animals. It seemed to me that the issue that really wasn't being very well addressed at the national level was overpopulation of cats and dogs. So I zoomed in on that, and I've been working at that ever since. So that's been, what is it, 20 now, and 10, 34 years or so in this work in various ways.
And for you, Dr. Jeff?
Well, I mean, I went into vet school a hunter, a trapper, pretty right wing, and I came out very left wing and a vegetarian. So there you go. And I worked animal control in vet school, and it really opened my eyes to the plight of pets, our so-called man's best friend, dogs, and companion animals in general. And that really, I ended up speaking about overpopulation and researching it and pound seizure and different things like that. And I really decided as a veterinarian, my first job was at a humane site, and I ended up killing 56 puppies in one day, all healthy. We just had to make room. We had too many, and puppies were a pain to take care of, and we couldn't adopt them anyway. So at that point, I quit that job and said, look, I became a veterinarian for a reason. I really think the key is to spay and neuter. And I really thought I could go out there and spay, neuter them all and take care of the problem in a few weeks, a few months, a few years. And 35 years later, we're still working on it. But we've made great inroads. I mean, from going to killing 24 to 26 million dogs and cats a year back in the late 70s, and it's just it's gone steadily down. It depends on who you read, anywhere from 1 million to 4 million to 6 million currently. And I just don't think we actually know. I don't think we ever have known. I think we get ballpark numbers, and it's probably, I always will believe it's higher than what they actually report because there's just so many animals. I mean, economic euthanasia. You take an animal in to be euthanized at a vet hospital, maybe for economic reasons. Does that really count as euthanasia? And in my mind, it does, because that animal could be in a home, or if you had the money, you could fix its broken leg or take the rock out of its stomach and versus put it to sleep. So there's a lot of fuzzy stats out there.
Well, I know, Jeff, that you had written this article back in 2017, and thanks to Esther for sending that out so I could read that too. And you wrote this really great article that we don't have the ability to adopt or foster or warehouse our way out of the issue. And this has become kind of the mantra of the no-kill movement. And I think it's just been pushed so heavily in looking at the data, particularly for the live release rate. And there hasn't been as strong of a focus on spay neuter and just how critically important that is. And so in this article, I know that you had this quote that was practicing no-kill sheltering while either neglecting animals or turning away animals in need does not mean that you love animals. It means that you love the idea of animals, you love the money that being no kill guarantees, and or you love the idea of your great sacrifice for the animals. And it was some pretty strong language, and it caught my attention. Just kind of this like condemning language of that this is not the solution. The no kill movement is not really where our focus should be. It's unfortunately what we've been focusing on for the past decade. And you spent a lot of time in this article talking about the need to spend more money on spay, neuter, and education than on sheltering. So I just kind of want to explore that with you and go a little bit more in depth on like your experience with um, refocusing our viewpoint from this live release rate to what the effects are of spay neuter, both in the short term and the long term.
Yeah. Um, I mean, that was several years ago, so 2017, I think you said. And to be honest with
Mm-hmm.
you, I had those, I'd say, my feelings several years before that, you know. Um, and it's just common sense. It just goes back to the same old thing. You can deal with an issue, at its core and get to the problem, or you deal with the aftermath, you know. And obviously, if you have a hurricane, you got to deal with the aftermath, you know. But you do things before the hurricane to minimize the aftermath. We're not doing the things ahead of time to minimize the aftermath of overpopulation, of euthanasia, of economic euthanasia, and I just shudder to think the number of cats out there that die slow, miserable deaths. They're kind of the redheaded stepchild of the veterinary world, animals in general, but dogs too. In underserved areas, 77% of the dogs never see a vet in underserved areas, poor areas. 87% are not fixed. So we can talk about Colorado or San Francisco and what a great job they're doing, and they have to bring animals in from other areas, which I'm totally opposed to transporting animals, because it's not that it's a bad thing for the any individual animal. It's a great thing for them, but once again, when does it stop? You raise all this money, you go down to the reservations, you bring 200 dogs off of it. Well, before you left, there's 200 more dogs being born on it. Um, and it's the same with feral cats. If you go out to feed feral cats and not to spay neuter them, to me, is immoral and just creating more of the problem. Because as you feed them more, guess what? They have more feral cats. It just becomes a dog chasing its tail with no end. And if you really care and are compassionate, the world's not fair, and that nature's very harsh. Things die miserable deaths all the time. There are many things worse than death, is my point. And I think you can find that balance. We just waste so much money. I mean, the Denver Dumb Frenzies just built a brand new $32 million shelter, and this is the 21st century. And I'm thinking, like, why don't you have a 24/7 full service hospital for anyone who wants to come in, that feels like they need to go to a lower income place. That's the future, and I've preached this, and it's the way it is in England with Dogs Trust, things like that. Every humane society, I've said for years, you should have a feral cat program. You should have a behaviorist on staff, or at least some kind of connection to someone who can do dog behavior. You should have a trainer, a hands-on trainer. Uh, you know, those are really basic things. How can you run a real shelter if you're not doing the sheltering work to rehab them, to change the behavior, to get them? We know 50% of animals go into shelters because of behavioral problems. So I think my words in 2017 are just as true now. Sure, we're not killing quite as many, but we also fudge the stats now a lot more, so that we really know how many we're killing. And I really believe economic euthanasia is as big a problem as overpopulation, simply because only 40% of Americans can afford current veterinary prices. That's the reality. 40%. That means 60% of us can't. And the vet profession is just we're pricing ourselves right out of the market for the last 2 or 3 decades. We're plenty busy. Don't get me wrong, every vet's busy, but we see a smaller percentage of overall animals than there actually is in America, which tells me there's a lot of left behind animals.
Well, there was just a shelter that I had read about. They just built this shelter in Queens, New York, in June, And by the end of July, 30 days later, this facility, I think they said, was built to house like 70 some dogs. And it was after a month, it was already operating at over 210% capacity in 1 month. I mean, just automatically filled up. And so
Yeah.
the statistics were shocking. You go and you look at any shelters, operating in Texas, almost every single one of them are at like 150% or higher. Um, and so, for me, like, I'm just wondering, because I wasn't around at this time. So, like, Esther, I know that we had chatted, like, in the 70s and 80s, like, how bad things were, when we had 12, 15 million, animals being euthanized every year. Um, and I think a lot of people just don't realize how bad things were back then. They don't remember, they weren't around. Even, with our executive directors that we have running shelters now, just weren't around at that time. So I think it's really important to chat with you folks who are very wise, can walk us through and show us that this is the answer to our overpopulation issue. But to understand this, what was it like back then? Like, we're talking about 70s and 80s when these euthanasia numbers were so high. How is it that we ended up getting away from spay and neuter?
Well, I've given that some thought, and I think one of the problems is that the people that are running things now in the shelters and the funding agencies never saw how bad things were back then. Between, as you said, between 12 and 17 million cats and dogs were euthanized each year. As of 1990, it was 12 million. I know this because when we prepared materials for the spay program, it was a million a month, so that's 12 million. So, but spay neuter became front and center as a priority, and by 2000, that number from 12 million went down to 4.8 million. That's a pretty big drop. But as you mentioned, the newer administrators who came in after 2010 had not done that hard work of facilitating and prioritizing spay neuter, and many of them did and do not still acknowledge the impact that the spay programs had. So entire areas in New England didn't have the surplus animals that came in 10 or 20 years earlier. They had the spay programs going. And then other areas just shipped cats and dogs into New England without building spay programs and clinics. So that continues to be a problem. And then what's worse, this funding started to dry up for spay neuter around 2010 to 2015. I don't have the year, maybe it wasn't a single year, but there was suddenly a drop in money for subsidizing spay neuter that had been there before. And this is really something. By 2023, some of the large organizations and funders were even saying that we don't need to spay or neuter before adoption, which was a key policy in the prior decade and what made these reduced numbers possible. So we've seen not only a drop in funding, but also a drop in some of the policies that were working. So it's pretty scary for those of us that have been in it for 30 years to see this happening, because we can see what's going to happen and what is happening.
I think a lot of this goes back to the whole no-kill movement. In reality, when you have a kill shelter in the same town as a no-kill shelter, people take their animals to the no-kill shelter. The problem with that is, and I can give you an example with a FOD and another group down in Mexico. I won't mention their names, but one's no kill, and all the white people that go down there, that stay down there, that buy houses down there, they contribute to this other group because they're no kill. Where a FOD has a very low kill rate, but they actually adopt like 60, 70 animals a month, which is amazing for Mexico. They have an incredible facility. They do spay neuter, they do outreach, but they don't get the same funding as the other group because they're no kill. But at the no kill shelter, you can go over there. There's eyeballs hanging out. There's tumors that need to be done. They have dogs given birth in rooms, and then they get parvo and die. I mean, when you have space, as you found out, you build it. If you build it, they will come. If you build a space for 200 animals, you have 400 or 600 animals, and you can't physically take care of those animals properly without putting huge amounts of money and time and energy and effort into that. And then if you get unadoptable animals in, depending on how you want to define that. Let's say they're super aggressive, or they just have some real behavioral problems, or they have some diseases or whatever, and they're not readily adoptable. Well, you have to put a lot of more money, energy, and effort into those animals. And if those are not adoptable, and you have 100 spaces. Well, eventually, as you adopt your adoptable animals, you end up with more and more unadoptable animals. So then you end up with a shelter with 90% unadoptable animals and 10% adoptable. And all your money is just going into those same animals. And to me, that just doesn't make sense. I accept euthanasia as a humane thing to do in the right circumstance. I don't accept it as a form of population control because it shouldn't have to be. And I don't think you should have to euthanize a healthy animal that's adoptable. But there are just circumstances that we don't have a lot of choices, and I don't think warehousing them is what dogs and cats are meant to be, shoved in cages and left there for years on end. I think it's the worst thing we can do for them.
Yeah, 100%. And it's really, really concerning, I think, for those of us in animal welfare who are very much in agreement with everything that you're saying there, is that we're finding these, no-kill shelters, these no-kill rescues, whatever, taking these animals in. I mean, they're living in these stacked crates for weeks, months, years on end in these horrific conditions. They're committing animal cruelty and neglect,
Absolutely.
themselves. And it's so, there's kind of like this altruistic, view of themselves as being like they're the saviors and we're saving everything, and we're doing all of this great work. And really, it's these other shelters who are ended up taking in these animals who are sick and injured and have behavioral problems and are aggressive towards other animals and such, and they have to end up doing the dirty work of euthanizing them. There's I can recall off the top of my head, a case in of course, Texas again, dog that is self-mutilating because it doesn't do well being caged. And instead of, euthanizing this dog that has severe behavioral problems that end up affecting itself, they bring it back into the shelter where they know that it's taking up that more room for other animals from the community that need to come and need to get treatment, who are suffering from some kind of illness or injury, or potentially can be treated or may need to end up being euthanized. It's so much far more reaching than just the animals that are like inside of the shelter. It affects all of the animals that are then outside of the shelter as well.
It's what happens beyond those four walls that's being.
And we talk about these live release rates. There's shelters that just literally give animals away. And I'm one of those people who believe every family should have a dog or a cat, and I really do believe that. I think it's good for you as humans. But ignoring that fact, you just can't. Every crackhead that comes through shouldn't get a dog or a cat. And I'll give you an example. A young couple who had some emotional issues went to a very pronounced, very well-known humane society in Colorado, in Boulder, Colorado, and came over, got a cat. And they took a bus to Boulder from Denver. They brought the bus back. They got off. They walked into my front clinic, and somewhere in between Boulder and Denver, they said, this cat seems kind of loud, and I don't think we can take care of it here, and handed it to us. All right. That's literally like an hour and a half after they adopted it. So I'm thinking, like, what kind of adoption criteria did they go through to be able to get this cat, And for the record, it wasn't spayed yet. They're supposed to take it back to get it spayed, And it's like I'm just scratching my head thinking, what the hell is wrong with this picture, So those things are just profound, and we're just shooting ourselves in the foot. And in the end, it's the animals that suffer.
Yeah, I used to do social work when I was first out of school, and child welfare. They would never give a child to a couple or a family that didn't meet certain standards. It just wouldn't happen. And why are we setting a lower bar for these animals that are supposedly in our care? If we're animal welfare advocates, then let's give them some welfare. Let's give them, let's give standards when we adopt them out. I just don't understand that giving them to anybody, or even giving them a reward for taking an animal.
Yeah.
If they can't manage to take care of it, then, and somehow so much of this is going on. It's even aside from the spay neuter stuff, but what's good about the spay neuter stuff, if we do reduce the numbers out there, then there's less of this going on, I hope. I mean, that should be the way it would work, that the standards can go up if the numbers go down. Do you agree?
Yeah, yeah.
You know, they say,
There's a
hey,
lot of
well,
psychology to
if you
all
need
this.
adoption, we'll go get it.
There's a lot of psychology to all this. I
Yes,
mean, like
there
cats are
is.
just so overrepresented in number of animals that are euthanized and abused, and yet most cat people you deal with,
Mhm.
most cat groups I deal with, if there's a pregnant cat, a feral cat that comes in, they don't want us to spay it, you know. And if we do spay it, then we're murderers. And you know, and they're the first people I always ask. You know, the hypocrisy is like, oh, you must be a vegan vegetarian. You know, they don't even know what a vegan vegetarian is. And I go, well, so it's okay to kill some animals for you when you want to kill them, but then other animals, and I hate to say it, pigs are every bit as smart as dogs, for the record. You know, and I've had a pet pig in here too. They're pretty cool. You know, so you know, and animals can interact. What we were taught in vet school is just no longer true. We know animals have the capacity to feel and to have emotions in just ways that we can't, you know, we can't fully understand, but they do incredible things, you know. And I think that has to be in the back of our minds all the time when we're dealing with stuff. And do I like the idea of euthanizing animals? No. But at the same time, I don't like the idea of animals dying slow, miserable deaths either, or living in conditions that are psychologically traumatizing, you know. The stereotypic bear that just sits
Mm-hmm.
and rocks back and forth because he's been in a little 5x5 cage for its whole life. You know, those things are pretty well gone in America, I like to think, but they still crawl around the world. And, you know, it's the same thing we do with our dogs and cats.
Mm-hmm.
You
Dr. Jeff, then is that the reason why, like, with your clinics, I know when someone comes in to have their animal treated, if they're not spayed or neutered, it's a policy and requirement that they are.
As far as I know, I was the first full service for-profit hospital that required that of all animals coming through our doors. Now we're 100% nonprofit. You know, a few more of the nonprofits have done that in the past. Like I say, they're kind of getting away from it to some degree, when, you know, before prior to adoption. But there's just no rationale not to. You know, from 5 weeks on, we do spay and neuter routinely, and nothing goes through our doors that's not fixed. And we see the consequences of the places where they're allowed to not to be adopted and not be fixed. You know, you never get ahead of the problem. So yeah, I think I think it's really important, and more and more vets. I was just talking to a vet yesterday. I was doing a spay neuter clinic yesterday in a small community in Colorado, and there was a vet there from a major hospital, and she does emergency work. And she said, "Yeah, if I had my way, I'd spay and neuter about everyone that comes because they're not breedable animals. But you know, I'm not allowed to. You know, we don't do that. You know, and I understand. There's a lot of vets that feel the same way I feel." But you know, because they work for someone else, they can't do it. You know, they encourage the people, but you know, and prices of spay neuter have gone up logarithmically too. So that's a big part. It seems like finances are one of the biggest single factors in not getting animals spayed or neutered.
Well, some of them are absolutely ridiculous. I mean, I've seen clinics, you know, listing their prices for spay neuter at like $1,000, and we were talking about how, you know, the cost of veterinary care has gone up so much. And like I say all of this, not blaming the vets, right? It's not the vet's fault. There are a lot of other factors that contribute to this, but I mean, that's when we're sitting here trying to reframe our focus on the importance of spay neuter and how it ends up ultimately saving lives in the end and reducing our population through shelters, it just doesn't make sense to me that we still have, you know, prices that are that high that it is, I mean, it's discouraging to people to not get it done, and we still don't have enough information out there to be able to tell people where you can go for these low cost spay neuter clinics. And Esther, I know that as a part of the United Spay Alliance, that was a
Mm-hmm.
whole bunch of work that you guys had done.
Mm-hmm.
So, and Jeff, I know that you had this 92 mobile clinic. So I wanted to ask you both, in those respects, the importance of those different programs that you had and why they were started, and what did you think that the results of those were in the end?
Esther?
Well, I'll go ahead and start then. I guess spay neuter was not a priority in 1990 or before 1990 when euthanasia stood at 12 million a year. At that time, there were not only very few clinics and programs, but most people didn't even know the word for spay. They were calling it sprayed or spaded. You don't get
Spaded.
that much anymore. I think people are spayed. Yeah, yeah, they got the picture. But what we did do was we got the words. First of all, you have to start with semantics. We got the word spay out there and into everyday use. We got the shelters to spay and neuter prior to adoption with a campaign we call the NBA program, NBA for neuter before adoption. And some states even passed laws mandating that, which proved to be a great thing in more recent times. We encourage people to start local spay neuter programs and clinics and help each other to do this. And we connected spay neuter groups within the states and across the country so they could be examples for each other and encourage each other and help with the problems and the solutions. We held and spoke at conferences about the need to spay neuter, and we worked really hard to reduce the accepted age within the veterinary profession from 6+ months after first litter to 5 months, or before 5 months, really. So, and in 2015, we started the United Spay Alliance. And now, evidently, we need to start over again. And we need to educate shelters about how spay neuter makes their job easier and work with animal control and public health. That's what we want to do. So in 1990, we had to promote the concept of spay neuter. And in 2015, or 2025, I guess it is, we need to find more funding for spay neuter and increase the number of vets who willingly provide the surgery, like Dr. Young.
The big humane societies are truly worth almost $1 billion, the first top 8 or so together. But they're sitting on hundreds of millions of dollars. And while I absolutely believe spay and neuter is the core of everything, I truly believe the future should be shelters connected to major veterinary hospitals, and whether those are independent or, I don't have a problem with shelters hiring vets, there's a lot of vets would rather work that they want to get away from the corporate. 70% of our practices are now owned by corporate. And the reason prices have gone up is not necessarily because of drug prices. Some of them are lower than they've been for years. I mean, COVID kind of hurt for a while. But in the end, it's as soon as you take over a vet thing and make it corporate, well, you have shareholders and they want to cut the profit, so you literally, your prices go up 3 to 4 times the moment it's bought out. And that's just, and everywhere I've talked to, that seems consistent. And since they represent the vast majority now, certainly in the small animal field, I don't see that trend changing until who's the only competition they can have truly are the shelters that can stand up to them. I mean, the big shelters, the big groups that are sitting on literally hundreds of millions of dollars, There should be at least 1 or 2 low-cost facilities in every state, funded by somebody. And I haven't stopped doing what I do. For the record, I just did a spay neuter clinic up in Hartselle, Colorado, small town, hour and a half away. This next weekend, I'm in Mexico for 2 days doing spay neuter and teaching a bunch of students down there. And then the next weekend, I'm in Victor, Colorado, doing spay neuter. So that's what I do on my Sundays, is spay neuter trips. And I was in 3 different reservations this summer. So, so that's what I do for fun. And I'll keep doing it. It's funding. It's tough. Everybody thinks because I've been on TV, I'm rich, and that's not the case. TV was actually kind of a pain for us, and it definitely a two-edged sword. But having said that, we always find a way to rub a few quarters together and get out there and get things done, and continue. And people are very appreciative, and they want it. That's the point. They come out. I mean, Hartselle's like, if you blink, you're through it, And yet we had like 100 people show up yesterday for shots and spay and neuter and stuff like that. And we had to turn a few people away, and we'll go back again. And they want us back. They said, please come back and do it a couple of times a year. It's a real rural environment, and a lot of those areas. They're not going to drive and spend $1,000 on a dog spay. First off, they don't have it. It's not that they don't have that kind of discretionary money. And that's kind of a catch-22 if you think about it. As we elevate the status of dogs and cats in society, they do have more intrinsic value to society. So therefore, vets can charge more. But then you have the people who don't have that kind of those funds, and that goes back to where 40% of people can't afford it, and about 60% can't. That goes back to other inequities in life, I guess.
Mm-hmm. When you go back to these areas, what is it that you notice after having been there and do mass spay neuter and doing wet labs and such? What do you see coming back from the people, the animals, and the health of everybody then?
It's a little hard to clarify in the States simply because you don't have concise areas people come and go all the time, but on reservations they're kind of that way. Fort Belknap, after I think it was 3 years, I think we dropped the euthanasia rate by like 97-98%. Not that they had a high one to begin with, but they did have some. And what we do find is that people look at the animals slightly different. They seem to be a little bit better taken care of. In Progreso, a town in Mexico, the first couple of years we did surgery there for street dogs and everything else. I mean, as soon as you put a dog on the table, fleas and ticks were just all over the place. It was just gross, And by the 3rd or 4th year, the animals were still semi-feral and out there, but they weren't as sick, And we know just from other stats that if you just start doing spay neuter in general, it elevates the health status of all the animals around them because they're not so many animals wandering around trying to get into fights. And, it's the same thing we see in Alabama and Georgia and places in rural environments where you have that very low vet care. Less than 77% of people ever see their dog sees an animal in their whole life. 87% are not fixed. And you have groups going down and just driving animals up by the truckload, puppies and moms pregnant and all that, to New York and different places, which sounds great on paper, but you've never turned off the spigot. You still got the flood going on down there. And until you turn off that spigot, when does it end? And how much money do we spend doing that versus if we actually took care of the animals in the proper way and we help subsidize, say, retired people, moms with 2 kids, people on fixed incomes, our veterans. We have all that extra money to help supplement them and keep animals in their household for the rest of their lives, versus having to give them up if they happen to get hit by a car or happen to get parvo or happen to eat a sock, which they either give them up or euthanize them now, and I just think we could do so much better as a society. And I think the humane groups should be stepping up a lot more for this. I really do believe.
Do you think that there's this idea about subsidization in the animal welfare world, where more and more people are actually starting to talk about government agencies funding and supporting these spay neuter clinics, these vaccine clinics, and such like that. What are your thoughts, to the both of you, on subsidizing veterinary care and spay neuter efforts nationally?
Well, it can be tricky if you have to build in a lot of things. It can go wrong. You can get into the wrong hands. We've seen that happen. That the thing gets built, but it doesn't have the proper
oversight.
What's the word? Things. Oversight. It doesn't have the right oversight. The people who take charge of it don't know what they're doing. They don't want to listen to the people who do know what they're doing. So we've watched some programs do very well. I think the New Hampshire program has done very well for 30, 40 years now. But others that we have seen up close and personal have just floundered. So I think it's a wonderful idea, but it has to be done. We have do's and don'ts for these programs.
I'm not necessarily known for my conservative nature. And I'll just say this: anytime you give government money, they tend to screw it up. So that's the conservative in me a little bit right there. But I'm very liberal. But no, I just seen. It depends on who's in charge of dispensing it. The problem is, it's like big business. Humane societies have become business, all right, and they have slicksters. They shake your hand, and they're just like politicians. No offense to all the politicians out there, but you know what I'm saying. They know how to talk to people, and they know how to schmooze you, and so they end up with the money, and the money seems to go to the same groups. It just kind of moves around to the same big groups, and I don't see a whole lot more work being done. I know. We fund some stuff here in Colorado, and I think it does some good. Don't get me wrong, but I think it could be more focused. I know a vet that's getting money from the state for doing space in there, but you basically they subsidize pretty much your regular prices, or just a little bit off your regular prices. So if instead of $500, maybe I get $450 or $400. Well, that's not going to make the money go very far. And then it also doesn't address ongoing issues in terms of health, in terms of those animals, in terms of vaccines and things like that, disease, hit by car. So I think we're just prioritizing things slightly different than I would do it if I was in charge of that money. And I think there's a lot of grassroots groups out there doing stuff. The big spay neuter clinics. And I'll be honest, state boards are making it harder and harder. They want more and more paperwork. We have pretty minimal paperwork when we're doing the road stuff, but at my clinic now, every client that comes through, I got to do like 3 pages of paperwork, have them sign off, just like on the human side. And it's just gotten to the point of being ridiculous. And it's all about, covering your butt more than anything else. And I still don't believe it's necessary, because I think if you're doing your job right, you shouldn't have to have people sign away, their firstborn, because, you may or may not do something right. But that's kind of the way it's come down, and I don't see that trend changing, as technology moves forward. So I could have my firstborn.
Well, what about a public-private partnership where the grassroots groups are doing the work, but they get subsidy money from let's say, the license plate fund. But again, it has to
Yeah.
be structured in the right way. And I think that's one of the things we want to be doing with United Spay Alliance is create guidelines for this kind of thing. And it's not easy because certain people are just, they jump in and take over.
Yeah.
And somehow you have to structure it. We're still working on that, I think, to find a really good state spay program. Like I said, New Hampshire's has been very good over decades. So there are formulas that make it work, and then the right people getting involved. That's why I said a public-private partnership where there's checks and balances. But the money can come from, in our case, in Maine, it's a combination of license plate money, donations, and a pet food surcharge. A few pennies per can, and it brought in quite a bit of money. So if it's done right, it can be a solution. It's just that I don't think we've found the program yet, the exact way to do it.
Yeah.
You know?
Well, they had a government program down in Pueblo, Colorado. This program in Pueblo, Colorado, in the first year, like from the shelter down there, anyone who adopted an animal could get their animal spayed or neutered for free at multiple vets. They all signed up, the vast majority signed up, and they got paid through the county, right? Less than 30% of people
Right. Yeah.
Less than 30%. And they just got busy. That's the thing, that people get busy with life, or the animal comes in heat, then it's pregnant. Well, I'm not going to fix it because it's pregnant. I'll take the puppies over, then I'll get it done, or the cat, the kitten's over. It's once again, we're not doing things that really maximize our input. We want to maximize our output,
Resources.
And we're not doing.
Well, the thing is, the voucher system really doesn't work. They were trying that for a while after COVID. We'll just give them a voucher, adopt them out with a voucher. We learned over the years that just doesn't work at all. And that's part of this problem of a newer generation taking over without really paying attention to the experience of people like you and some of the other people over the last 30 years that were doing this work and seeing what does work and what doesn't. I think, what is that? There's a quote, if I can find it real quick here. Probably I can't, but those who refuse to study history are doomed to repeat it, or something. Santayana was the author. That's the essence of it.
No, 100%. I 100% agree. And that's why I thought it was like so important having, especially you two with being so huge in your respective fields, to come on and talk about, the history of spay and neuter and what's going on now and where we should be going in the future, because it's just things that just don't get talked about. I think, for the agencies that I've been with the vast majority of people, whether they're, low-level officers or all the way up to executives, don't talk about learning from the past. And so a lot of this data, Esther, that I know that you've given me, I know that there was a figure from Animals 24/7 that you had provided to me for the state of New Hampshire, and the data that was done there for like a 10-year time frame in the 90s and showing the work of that, the proactive, aggressive spay and neuter throughout the entire state ended up leading over, I think it was a 9-year period, a 60% drop in euthanasias in shelters statewide. That when you talk about that number, that's massive, and it's almost mind-boggling to me to think like that in a relatively short period of time, 60% drop. If we're all talking about wanting to save as many animals as possible and not having to euthanize and all of this, why are we not paying attention to this more? It's making me crazy.
You think it's making you crazy? Imagine working for 25 or 30 years in this thing. It really makes you crazy.
It's
very painful.
I'm only 20 years old. I just look like this because I work in this field.
Yeah, it's enough to tear your hair out, isn't it? Sometimes. I don't know. I can only hope that it's a pendulum that will swing the other way. That is a hope. And it's people like Rae that will help make that happen. I think she's bringing awareness up, and it's going to be a lot of work to make that pendulum come the other way again, I think. Don't you agree?
Oh, absolutely. I want to read this to you. This was from Animal Sheltering, November, December 2013, so it's old. Hattiesburg, Mississippi, USA. From 2007 to 2010, the shelter intake was about 9,000 per year. Okay, it's not a very big town. They opened a low-cost subsidized clinic. Now, this is not 100%, just subsidized in 2011, okay? Intake dropped to 6,477 in 2012, so that's about 3,000 off. And then the next year, or 2011, so it's opened. They opened the thing in 2011, and in 2012 it dropped to 4,900. So you knock 4,000 animals that would have entered that shelter just don't enter it. That allows you to have close to a no-kill shelter in terms of in a humane way. The idea of sheltering is not to have a whole bunch of animals in there. It's to pick up animals after a storm, or take animals off someone's hand that just had a stroke and they can't handle them anymore. Sheltering should be looked at it in that way. Is kind of the last resort, but here it is. And they go into the shelter and they're not there for 6 months or 3 months. They're there for 2, 3, 6 weeks. We get them fixed, we get them cleaned up. Tell the story, and we get them out. And if you have hundreds, you just can't do that because we don't have hundreds of people lining up to take them. That's the reality of it.
And sort of as a counterpoint to that, I have a quote here. There was an article in USA Today, how many dogs are euthanized in the U.S. every year, and they went to ask one of the people that they were interviewing, how can you help overcrowded pet shelters? And so there's a little short 4 sentences here. This person that they were interviewing said, efforts need to focus on the promotion of shelter adoptions. Rescuing your pet from a sheltering organization needs to be something of a pride point, something to brag about. And encouraging your friends and family to do the same is number one call to action. Doing so not only saves lives, but sends a much needed message of support to struggling shelters and their staff. While adopting a pet isn't possible for everyone, he said, there are other ways to help by fostering pets or volunteering at or donating to local shelters. Not a word about spaying and neutering. Not a word. Or about a shelter clinic or a spay neuter clinic or anything. They don't even mention it. It's like it doesn't exist anymore. That's what's so frustrating.
Yeah.
Also, I think that a lot of people just still don't even know where you can go and get your dog or cat spayed or neutered at a low-cost clinic. And Esther, I know for the United Spay Alliance that you guys work with every state. You have leads in every state that. Your website actually has a map of the entire U.S. You can go, and it's an interactive map. You can click on it. You can figure out what are all of the low-cost spay neuter clinics in your area, whether they're mobile clinics or they're brick and mortar. And it has a whole list. It'll give you your phone number, the address, when they're open, when the clinic dates are. You really have tried to make things as clear as possible for people to give them the resources and show them. But this is my I have been doing this for like a decade now too. And this is a resource that even I didn't know about until several months ago. So, that's the point that I think that we're all, I'm trying to make here, is that people still are not aware of these things, that they have access to these different types of clinics and such. I think it's so important. And also, like Esther, the work that you're doing with the United Spay Alliance, and then Dr. Jeff. You're part of the Fix by 5 program. So, if for people who've never heard of that, what is the Fix by 5 all about?
That's Esther's baby.
Basically, it's sort of, that's my baby. What surprised me right along is that with all these big organizations, nobody ever kind of figured out that the shelters are full of cats all the time, but yet vets weren't spaying them till they had their first heat or their first litter. 6 months was the age that they recommended. And I said, well, you know what? If they move back by 4 weeks, that would be 5 months, which isn't such a big spread. You're not asking them to neuter them at 1 month or 2 months. So by 5 months, and we worked hard for years on that. We went to vet conferences, and in the end, we met with several vets in Florida at one of the big vet conferences. And by the end of the afternoon, we had an agreement with 5 points, and that was the Fix by 5 agreement, we call it. And that, I don't know, across the country, we don't really get a good bird's eye view. Maybe you would know better, Jeff, if people are really turning more to spaying by 5 months now. We have a list on our United Spay Alliance site, but have you had any sense about whether vets are accepting this norm or this new policy?
I think pre-pupil spay neuter has kind of been controversial since it kind of manifested. in the 90s. But having said that, and part of it, most of the literature for years and years was very pro spay neuter and has been. UC Davis put out some garbage research, and I'll call it garbage research because they even admit it's not complete. But like they look at one breed and they do surveys. They're not good studies, and they'll make these. They're not necessarily making the conclusion, but they write what they find, and other people will read them and say, "Oh, so you can't do this, you can't do that." So there's been some pushback against spay neuter, but even UC Davis's own program says, in their long-term research program said, "Look, spay neuter animals live longer, 1 to 3 years longer for dogs, 3 to 5 years longer for cats." Period. In the discussion. So if you live 3 years longer, you may have a certain increase in more cancer rate. Well, it's like living 70 versus 80. You're probably going to pick up cancer or something else in there that you weren't planning on. You got to die of something, right? So I just think there's a lot of misinformation out there. I think a lot of vets still think it's tricky and hard to anesthetize, smaller animals. And it's 5 months that the AVMA pretty much everyone's agreed to. And my thing is 5 weeks. And if they're 5 weeks, I'll do them no problem. And you don't have problems. They bounce back. They literally get up. They want to eat. They want to play. They don't even know anything happened to them. It's so much more rewarding than doing a pregnant dog or a dog that's in heat or something. And so I don't know. It's. I think more people are open to it. Certainly, all the students that come through my place, I had 6 contact me this last week that want to come out. That are all from vet schools here in the States, and we'll show them that we do pre-pup stuff, and that everyone has always been very excited about it. You hear things like, "Oh, you have to have special surgical equipment." No, it's not true. We've just come so far with anesthetics and stuff. It works great. And if we can get them before their first heat cycle, there's a certain advantage. But more than anything, I don't necessarily have a problem with people waiting if it's their own animal, for a while. But you can't have a cat and let it go outside at 6 months. It's just irresponsible. If you want your Great Dane to wait till it's a year old or a year and a half, then that's fine. It's a different story.
Yeah. But remember what we were trying to do, what we're trying to achieve was to get the big vet associations to endorse this.
Yeah.
We know that there's people like you that endorse it, that are out front. But what we want to do is policy, best practice policy. So we figured somewhere between 6 months and 4 months, we could get them to agree, and they did. They agreed that 5 months would. And as long as they're not gotten into their first heat yet, it's okay. They still get the benefits of it. So, and by the way, it says by 5 months. So 2 months is definitely acceptable, and 3 months and 4 months, they're all acceptable. It's just by 5 months that we said. So we're very careful in our semantics with that.
We've never had good science on it. Prepubertal stuff goes back to the turn of the century. They talk about the blood of the spay. The anesthetics were always the big problem. Even when I travel, when I first started going to Eastern Europe, it's not the surgery, it's the anesthetics and things like that. But we've come so much farther. But you ask, the average vet, well, why do you pick the time you pick? They don't know. It's arbitrary. So much of what we do is arbitrary. It's just, this is the way we've always done it. And so we teach 1 year, we teach 9 months, we teach 6 months, whatever it may be. But what's the science behind it? That's kind of like there's no science behind it. It's just the way we do it. That's pretty much the answer you get. Well, that's the way we've always done it. So that's the way we do it. Well, keep hitting yourself in the head with a hammer. At some point, you may want to stop
because it feels so good, right?
But Dr. Jeff, and you all, even Esther with the United Spay Alliance, the setting up all these wet labs. I know that you guys just did one in Boston the other day, and these wet labs are important. And so I always like hearing from you guys and from vets about what are the workarounds that we can provide in light of this vet shortage and veterinary training.
Well, we're starting small with United Spay Alliance. It's sort of like a pilot project, and what we're doing 1-day labs with veterinarians that are already licensed and they already do surgery, so it's not brand new to them. But what we do is have a full day with a dry lab in the morning and videos and lecture and questions, and then starting around 10, 11 o'clock, spay neuter till the end of the day. And usually we have a ratio of 2 students to every vet teacher, two trainees, we say, for every trainer. And it's very small right now because we're just getting our feet wet, but the idea is we would do this in every state. And we're starting to spread. It's going down as far as Georgia right now and Pennsylvania, Indiana. It started in New England, and to me, that's just step one. That's the baby step to just get things started. Because my dream is that this will be in vet schools, that they will teach these methods, these techniques in vet schools, because they really should. Vets should have this before they graduate, and right now they don't get this training. So we're just starting with small trainings here and there, and hope that it will grow into the vet schools taking it over. They're taking over that job that we're doing now. Jeff, what are your thoughts?
Well, I don't see vet schools taking it over simply because they teach the highest level of sterility possible, like very similar to humans. And there's nothing wrong with that. They know once you get, and they'll tell you once you get out, you know you're going to go down. You're not going to do what we're doing here because it's expensive as hell, and it's not necessary. It's one thing if you're putting a plate in or you're doing a heart surgery, okay, maybe a little bit more. But I'm sorry, what we've done is move human medicine over to animals, and we're trying to justify this, and so we can charge more and things like that. But I'm sorry, if you do your job right, time on the table, those kind of things. The Spay Neuter Compendium said capping, gowning, masking was all optional. So in reality, soft tissue surgeries just don't get infected. And if they do, 90% of the time it's because the dog or the cat licked their sutures out, or some other dog did, or they laid a mud puddle. It's not because of something they picked up during the surgery. It just doesn't work that way. I do dozens and dozens of surgeries every week, and it's really rare I have a complication other than on an animal that just chewed something out. So from that perspective, I don't see. What vet schools do is they send their students to Mexico. They send their students to reservations, which I see, once again, hypocrisy all the way. So we can't do that in our own backyard. We can't help, here in Fort Collins or in Colorado, like Colorado State. And I love Colorado State, and they're amazing. But, they don't really have those kind of outreach, mobile, high volume type clinics available, And the students that do work at a Humane Society go down to the Denver Friends League, which is an AHA hospital that they have, and they're going to, do 2 animals in a day or whatever. They're not going to do the high volume. They're not going to be taught how to do the mobile stuff, and we need a lot more of that. I'm a firm believer you need to go. Poor people make poor decisions all the time, and they don't have lots of resources. You can't depend on them to book an appointment and bring the animal to you if you're 20 miles or 40 miles or 100 miles away. We need to find ways to go to those people. And I've always said that. I really believe that, and right there, that eliminates doing it the AHA hospital way, or, the top of the line way, because you do 2 surgeries a day that way, and it just costs you $1,000, So things can be done much, much cheaper. And I'm sorry, it's every bit as safe. And statistics have backed me up on this, It's just the reality of it.
That's important. I think sometimes they were saying that doing it more efficiently and so forth is not safe or not sterile.
But I've seen you, Jeff, go to all these different, you go to like a town hall or you go to like a church or these areas, just a building, and set up these, fold out tables, and there you are, boom, at it, doing surgery.
We're in a firehouse yesterday. We were in a firehouse yesterday. I haven't got any calls this morning, so I assume everybody's doing okay. I mean, the level. It depends on who's doing the surgery for sure. It depends on time on the surgery table, those kind of things, the type of suture you use. So, there's things you can do to stack things in your favor. But it's really, I say, it's pretty rare we have complication from routine surgeries, And teaching vet school students early on, I think, is really important. That's why I have vet students. We have a dorm room set up for students to come to our facility. And we've had vet students come in from, I think, 8 different universities so far. We'd like to get that up a lot higher and get more through. But as soon as I get set up a little bit more, and I'm hoping to get some of these other students in, But, I think that's all we can do is keep teaching the kids that are interested and hope that they will make a difference. And there's some really good paying jobs out there for, Humane Society vets and spay neuter vets.
Do you think that there's anything that shelters can do to help vet students in getting experience? If they say they have like a weekend high volume clinic or something like that?
Yeah, it's a matter of, are the shelters set up? So many of the shelters are not set up with spay neuter programs in house, and that's why I say I really think the future is my new hospital, we took over Humane Society up here in Conifer, Intermountain Humane Society. My goal is to build a complex on addition to my facility, and that's going to be the dog adoption ward, and we're going to put the cat adoption ward upstairs, and have that all in one facility. And there are a lot of places in Europe that do that kind of thing. And I really do think that's a really cool way to approach the future. I mean, once again, some of these groups are sitting on hundreds of millions of dollars. You could put a couple of those, clinics and adoption facilities, and you have everything there, and there's just no reason why you can't be teaching, and you just can't do more outreach. It's available. We have the money, we have the know-how. There's no reason why we shouldn't be doing it. People in society that are writing these big checks to these groups need to stop looking at the Hollywood propaganda, and understand they're being sold something, but that man, what am I getting for my dollar? That's the question. How are you making a real difference? And do you really need to have $200 million in your bank account? Maybe you do if you're paying your CEO $200 million a year. I don't know.
I love the idea of having the shelter and the hospital, the clinic in the same building. I mean, it makes so much sense. That sometimes the shelters have a hard time finding private beds to do the surgery, but this way it's all part of the same complex. That makes so much sense.
That's what I want to work for. I'm going to build one. And
Dr. Jeff, what do you? Well, I know, like I guess my last question on this aspect of it is the AVMA has come out very much so against this idea of this new position of like a veterinary assistant, or whatever they want to call it in whatever state you're in. And that has been one of the solutions that has been proposed by shelters and executives, around the country as solutions to this veterinary shortage problem, and particularly when it comes to these surgeries and spay neuters that need to be done. And the AVMA has come out and said that they don't support this. They think it's a terrible idea for all of these different reasons. What is your opinion on that? And I mean, to explain better from your perspective, why is it that there's so much against this?
Well, that's a simple one: money. And that's what it boils down to. Follow the money. In the end, I'm sorry. You look on the human side. You have scrub nurses that close. You have you have PAs, physician assistants. I went to a PA, never saw a doctor for years, and I love my PA, and he was really good at what he did, and I've had 16 surgeries on my own body, and several times I know for a fact that it was not my surgeon that closed, it was somebody else, and I didn't have a problem with that. I think it's a matter of, and this is the problem in my profession, is we just tend to, when the overpopulation was going strong, and there's all this talk, all these groups started building these big clinics and doing mobile stuff. And sure, we have to hire vets, but as a profession, we never really addressed overpopulation, and we still haven't, as a profession. We tend to bury our heads in the sand, and we have a ballot initiative here in Colorado. I think it's 192. 195, which is going to give techs quite a bit of leeway, in doing stuff. But see, the vets part, we haven't got any really vet input on that per se. It's kind of citizen driven, and at some point the board's going to have to get involved in all that. But my thing's always been, why don't we take command of the ship and instead of letting other people drive it and haul us like a anchor from behind, which is what we've done. And and I don't know, maybe we're all so busy, maybe we just don't care. I think a lot of it is we think that somehow, I was told by a vet already, they're not going to vote for it because they feel like it's the way corporate is going to have, be able to hire people, not hire vets. And so they won't have to pay a vet. You can hire a vet tech, and so therefore they could do a lot of the work the vet does. Well, none of us are going to go into business. We're just so afraid. We circle the wagons all the time. Every time we think someone's, they're going to do a vaccine clinic over here. They're going to do a spay neuter. It's going to put me out of business. Vets don't go out of business. We do not go out of business. Most of us have more work than we can handle. And there's a need for some more out there. So I think it's all a false narrative. I really do. But I think it's just human nature to circle the wagons and protect your financial investment. And that's what it's about.
But the AMA, the Parallel Organization for Human Health, they didn't seem to have such a problem. 60 years ago, they approved physician's assistants. And I don't know how we would cope today without physician's assistants, with all the
Exactly.
people, lining up in clinics.
Yeah.
So why is it that the AMA accepted the idea of a physician's assistant and the AVMA won't go along with
Yeah.
the parallel thing? Certainly hasn't ruined the MDs at all. I don't think it's going to ruin the DVMs either if they have this additional help. They're doing the shots and all kinds of work that the doctors wouldn't have to do, the vets wouldn't have to do. It would seem it would be much better, but I don't understand why not. If the AMA was able to approve, they're pretty conservative too, then why not the AVMA?
Well, and if you look at shelters in general, the shelter medicine side of it in particular, I'm sorry, you can teach a monkey to do most of that. I mean, parvo is parvo, distemper is distemper, lepto is lepto. It doesn't change, those things. You're going to treat it a certain way. Once you learn how to treat it, you know, any moron can do the same treatment every day just based on weight, on the animal and things like that. Spay neuter is not that hard. Certainly, neutering is not that hard. Treat people neutering is really easy. So, I mean, yeah, I don't expect them to be doing, chest surgeries and mass removals necessarily in abdominal cavity, but if they can do some basic things, it's just going to be real positive for animals and for people in the end. And maybe we can get more of these low income type clinics set up, to where people are actually driven to help animals, not just, not just to make money. And don't get me wrong, I'm all for making money. I always say, assume for a second I'm in it for at least a few dollars. I like making a living, but you don't have to. I don't know. You don't have to make a gross living. I think you start making more than about $200,000 a year. I think no one's worth that. I don't make that for the record. But, I mean, I can make three times more. I can make three times more and work half as much if I wanted to go, do something with corporate, and that's the reality. And my wife could probably make three times more. She's an incredible bone surgeon, can do anything with plates and pins and stuff. And so, but we choose to do what we do because we love it and we get a reward from it. And I want to see that, and I'm seeing that in some of the kids coming up, that they have that drive, that they want the reward. They don't necessarily, I mean, money's a reality. They got to make money, but they want satisfaction in life. And why does the vet profession have such a high depression and suicide rate? I'll tell you why. Because you work for corporate, and guess what? You don't get to help that animal. You got to kill it instead of helping it, or you got to send it out the door because they don't have the money. So it walks out with a broken leg, and all you can do is call animal control and say, hey, will you check on this animal? Do a welfare check. That's no way to be a professional.
For so many conditions that are so easily treated, if they needed to do a dental or maybe they have a URI or something like that.
Yeah, exactly.
Why is it, Dr. Jeff, why is it that we have not found, have not pushed, have not invested for a non-surgical birth control for animals? I mean,
Oh, we
to
have.
me, it kind of makes sense to push, but it doesn't seem like it's super prevalent. I mean, nobody's saying, oh, my dog's on the pill, so.
Well, it's different. Dogs cycle totally different. It's the exact opposite of humans in a lot of ways. And the reality of it is, I think we're real close to having an injectable that's going to be on the market pretty soon. But once again, it's big business. It's you get people down, and if you find something and you can make it's going to cost you millions of dollars to get it on the market. So you have that issue, to get FDA and USDA and all that approved, you're probably looking at $20 million or $24 million. So, you want a return on that investment. People who invest in those kind of things. So you're going to bring it in at the average cost of a spay or neuter. Well, what's an average cost of a spay or neuter? So yeah, you get the injection, it works, but it's still going to be $250 for the injection or whatever you decide, So that's, it's who this, once you have all these big groups sitting on hundreds of $1,000,000, why don't they put up $50 million and do research on it? They don't. I think there was one person that offered something like $100 million, $75 million, if someone could come up with something that actually worked. So there's plenty of money out there for someone smart enough to come up with it. And I gotta believe you have it. I mean, we can do it with horses, we can do it with deer and stuff. So, it's a matter of finding it for, why can't we do it with dogs and cats? And they are a little bit different. I'll be the first to admit. But I do think there's some things coming. I think Ruth Steinberger, is working on some stuff that looks really promising. The politics of it is amazing, and I do think there's probably things out there that we don't know about that have been picked up, scooped up, and probably put in a safe and locked up. You know, because I mean, I went to some of these meetings 20 some years ago, and we're right around the corner. We're almost there. We got this coming and this coming. I said, what happened to that? You know, the company no longer exists. You know, you kind of scratch your head. Okay, were they really that close? You know, were they just soliciting money, or did someone buy it up? You know, I don't know. You know, it does make me wonder. And spay and neuter is still the number one surgery that veterinarians do throughout America. You know, so it is a moneymaker, especially at $1,000 for a dog neuter or $400 for a cat neuter, which is ridiculous.
Well, I think so. We have so many vets, who have mobile clinics. I know we were talking with Dr. G, who's works with United Spay Alliance. He's doing these spay and neuters for next to nothing, and still has a prominent business. She could still pay her staff. She could still take care of her brick and mortar facilities and get her rescue units and stuff on there. Like, it's viable. It's there.
Yeah.
It's, I think, like learning from these, from you, from other vets, these programs, and getting them out there, getting the word out there so people are exposed and know about these things. So, I mean, Esther and Jeff, before we wrap up here, is there anything that I missed, that I didn't cover, that you want to make sure that anybody who's tuning into this is aware of, and anything that I didn't cover?
Well, I would like to request that you put the website for United Spay Alliance up there somewhere in the podcast. You know what it is. And because we're looking for people that are passionate about this, like Jeff is and you are, to help make this. The fact that you didn't know about us and the services that we have is sad, because we were doing our best to get the word out. We need more people to do that, and we want to do more wet labs, and there's just a lot of things that we're able to do that are under our control. So if you could just help people to reach us, and we hope that people that are passionate will reach out and join us. And we really do have to start over where we were 30 years ago, and so we need people to do that, and funding, so that would help a lot.
Yep,
I think
sure will.
Yeah, I think pendulums swing. And, it wasn't that many years ago that vets have always been pretty well respected. We never made a great living, but we always were part of the community, and we had solid livings. We were definitely upper middle class, and now the prices are just getting to be ridiculous, and the cost of education is getting to be ridiculous, and I get into the politics of all that. But in the end, I think greed somewhere along the lines in the 80s and 90s has just taken over America in a lot of ways. But I think the kids coming up, I really believe, well, they're disillusioned, and I think they're pushing back. And I do think this pendulum has to go the other way. It can't be just about money. You have to make a living, granted, but you want job satisfaction. You want to believe in what you're doing. And I think people that get in this profession, I want to believe most of them have some carrying capacity, and they want to make some difference. And you can't lock yourself up in an AHA hospital and see 5 clearance a day, or do 1-2 surgeries a day, and think you're making a big difference. You make a difference to those in the animals, and I get it, but you can just do so much more. There's so much more out there to be done, and I believe the pendulum's going to go back the other way. I really do. I think the kids coming up seem amazing to me, and I'm keeping my fingers crossed, and I hope I live long enough to see it.
Well, I think, like, when COVID happened, the solution wasn't to build more hospitals and build more morgues. I mean, the solution was a vaccine and building that herd immunity. And I think that it's a really great metaphor for the Spay Neuter initiative. Is that we don't need more shelters, we don't need more kennels, we need the solution, and Spay is the way. I'm trying to promote that, so Spay is the way.
I'll buy the
Well,
bumpers.
Esther and Dr. Jeff, I
Yeah, great. Thank you.
thank you so much, both of you, for coming on to the podcast. We really appreciate this. It is so lovely to learn from people who are experts, who have been doing this for so long, to learn from you. So you're very highly respected on here, and I know across the country. So I just really appreciate all of your work and everything that you have done, for animals and for people just around the world. So thank you.
Thank you. Thank you for being a voice, a powerful voice for this. change that needs to happen.
Thank you very much, Ray. And I'll just say Esther Meckler is a force of nature, and she's done more to help animals, dogs and cats, than anyone ever met.
And thanks to all of our listeners for tuning into the AWIP podcast. We'll see you next week.